Hi, this is Dr. Frank with Call Me MD. Today we're going to talk about a disease which often goes undiagnosed and can lead to some serious negative health effects if not treated appropriately. And that disease is obstructive sleep apnea. Obstructive sleep apnea is a disease in which a person stops breathing several times while they are asleep. This happens because of an obstruction in the upper airways that blocks the flow of air. This is usually caused by a combination of the shape of that person's upper airways and other factors such as having extra fatty tissue that blocks them off due to being overweight. The most common symptoms are daytime sleepiness and snoring, but it can also present with choking, gasping, or waking up in the middle of the night short of breath. It can also present with poor concentration during the day or headaches when waking in the morning. Although it may not seem like a serious disease, having obstructive sleep apnea can increase your risk of heart disease and many other medical problems. In fact, people with sleep apnea that's poorly controlled have a 2 to 3 times higher risk of all-cause death, and also have a risk of car accidents increased by 2 to 3 times as well. When you aren't breathing when you're asleep, your body isn't getting enough oxygen, and to compensate, your body does two things. It increases your blood pressure, and it also increases the number of red blood cells you have. This causes an increased risk of stroke and heart disease. Another thing your body can do is to create new blood vessels in areas that aren't getting the oxygen they need. While this might seem like a good thing, it causes a problem because those increased blood vessels put you at a much higher risk for getting cancer. Diagnosis of obstructive sleep apnea is made by a combination of a good history and physical exam and a test known as polysomnography, also known as a sleep study. During this, you are taken to a private room and connected to several monitoring devices to see how often and how badly you stop breathing while asleep. 3 common ways of treating sleep apnea include losing weight, using a positive airway pressure device while asleep, and surgery. Other ways that you can treat sleep apnea are by not sleeping on your back, not drinking alcohol, and removing sedating drugs or drugs that cause weight gain from your regimen. Obstructive sleep apnea is both incredibly common and deadly. If you have symptoms like snoring at night or having difficulty staying awake during the day, you should contact your doctor to see if you should get further testing. Sleep apnea is both easy to treat and can save you years on your life if treated properly. If you like this video, please leave a comment or subscribe.